Okay, number 5 on our list is what are the treatment options for scoliosis? So this is a big one, and everybody wants to know the answer to this, and it really depends. So I'll start from the simplest to the most complex. So the simplest thing sometimes is you don't need to do anything. The scoliosis is so mild, the child has very little growth remaining, so you just keep an eye on it, and once the growth is over, you have a little curvature in your spine, but it doesn't affect quality of life or activities in any way. If the child has a lot of growth remaining and there's a decent sized curve, and we measure this on x-ray, then sometimes the patient needs a brace. And there's all sorts of braces, but the brace is usually under the arm, above the hips. It corrects the curve to hold it in place. And the main goal of this brace is to make sure that the curve does not get worse. And there are these physical therapy exercises called Schroth therapy, which is super specific to patients with scoliosis. And we have lots of specialists in the area that can really work with patients. And again, the point of these exercises is to work with the brace, to work with the patient's body to potentially help the curve from not getting worse. None of these things really make the curve go away once it's there, except for the final couple options, which are surgery. And really, we save surgery for patients who have really big curves, like this patient behind us here, or have a lot of growth remaining, and we know that it's going to get worse to the point of needing a major surgery. So we do the surgery to prevent any further progression of the scoliosis. So what are the surgical options? The most commonly done one is called a posterior spine fusion. So you go through the back, you separate the muscles out of the way, look at the bones, and really correct the curve, put screws and rods in and hold it in place so that the curve doesn't get worse and the previously curved spine now looks pretty close to straight. There are newer technologies called vertebral body tethering, which you go more to the side of the patient and put screws in through the front and put a tight rope in. And this is reserved really only for patients that are still growing. Because what this does is it maintains the flexibility, and as the patient grows, the rope holds the curve on one side so that it can grow on a straight fashion when the kids are still growing. It's super cool technology. We're still learning a lot about it. It's not right for everybody, but we certainly think about it when it is an option.